Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Good that we have the most famous physical therapist on the internet.
Oh, in our opinion, of course, Bob.
Right. Today, Brad, we're going to talk about best sleeping position after a total knee or total hip surgery. This is your baby. You got to take it away, Brad. Talk.
Did we do the intro yet?
Oh, yeah, we just did the intro.
In our opinion, of course,
Yes,
Bob.
we did all that.
I was really
Yeah,
thinking
you really,
about
you
this.
really
Yeah.
are out of it today.
Okay, yeah. So sleeping position, we really want to talk, a lot of people, you got to get your sleep, but you got to
Right.
protect the injured or the involved knee or hip, whichever you had the surgery on. So you got to attend to that. But if you don't get your sleep, we were just discussing
Yeah, we
this
were having this
beforehand.
discussion in depth that it's imperative that you get sleep.
Right.
Because that's how healing happens, and that's how you're going to be able to participate in rehab during the day.
Right.
But if you're tired and crabby, it's
We've
just not
both
gonna work.
had patients that are coming, oh, I didn't get any sleep last
Right.
night. And
it just doesn't go well.
yeah, you're not very productive. So these are some tips that you're going to want to use after your surgery and have good success.
Yeah. Now, if your doctor's saying that they want you in a certain position, you got to follow their guidelines.
Right.
But we're going to tell you, basically what we'll tell patients if there aren't any specific guidelines.
Right.
This is what we tell our people.
Okay.
So
for
by the way, our people.
oh, there they are.
If you are new to our channel, please take a second to subscribe to us and become one of our people. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, go over to Facebook and like us and become one of our people over there, because Brad and I, as children, we're not liked, and we're trying to get together a cult.
yeah,
So-
sooner or later. All right, TKA, that's what we
Right.
call it, total knee
Knee
arthroplasty.
arthroplasty.
You got a new knee and you need to sleep well. They're going to help you in the hospital. You're going to be kind of drugged up a little bit. When you get home, you may forget some of the things they tell you, so look at this video and we'll cue you in.
Okay.
First thing, you have a pillow under your head.
All right.
That's important.
Sounds good.
The next thing, hopefully, you may need one of these
A leg lifter.
to get in and out of bed
Yep.
without injuring or hurting the knee. And they work nice. You get under there on your foot, and you're not going to wear your shoes to bed like this. But you might lay down on the couch for the day or the bed in the middle of the day with your, your slippers on, depending
Right.
on your what you like. And you're going to get up there and here. And now, one thing's for sure, if you're watching this before your surgery, you're not going to sleep on your stomach at all. If you're a
Right.
stomach sleeper, you're not going to do it after surgery.
Right.
Okay.
That one's ruled out.
Right.
For sure.
Okay. The next thing is the pillow under. A lot of people want to put the pillow underneath their knee because it's going to feel good that way.
Right. So this is a no-no.
Right.
Because they don't want the knee bent all night long.
Right. But it'll feel good.
It'll
But
feel
you can't
good.
do that.
So we would suggest putting it underneath the calf like this,
Yep.
the length of the calf
Sure.
and the foot too.
Yep.
And that way you're getting the knee. It's going. It's trying to go into straightening,
Right. Yep.
extension, but it's not putting it into the harmful
Right.
flexion.
And if you do put it way down here, it's going to give you some good extension, straighten it out, but it's probably going to
Yeah,
be
you probably
very
won't be able to.
uncomfortable.
You probably won't be able to sleep that way.
You 5 or 10
So-
minutes of that, and you'll be very uncomfortable. The other thing I did want to mention, Bob, particularly if you're diabetic or have fragile skin, the heel, it's nice here to have the little
That's a good point.
the
Yep.
air gap so that you don't get a pressure.
So there's no pressure on the heel at all here, which
Right.
again, it's surprising. I've seen relatively healthy people that were in bed. I remember one that she was a physical therapy instructor,
Yep.
and she got a compression fracture, and she was in her 50s, and she would push on the bed with her heels
Yep.
to get herself in position, and her skin broke down.
Ah.
I mean, just from doing it constantly, so it's not hard to do.
Yeah, even if you're younger and
Yeah.
reasonably healthy.
We consider 50 younger, by the way.
That's right. Bob, let's get the wedge out.
Okay.
There it is. Now, with total knees, you can use the wedge, and I've used it on patients, but there's some things you have to be aware of because it bends the knee.
Right.
It's usually much more comfortable for people. They love it, but you have to take a pillow or two. Oh, there's one.
What are we doing, Brad?
You got to put it under the calf.
Oh, sure.
There.
So we're-
Give me
a
another
little-
one,
another
too.
one, huh?
Yep. And then you go like that.
So now you're getting some straightening at the knee.
Right.
Yeah.
And I've done this with people who have swelling problems from the knee down after their surgery, and they're all edematous and swollen. This elevates the leg to above heart level, which is a general
Yeah,
rule.
remember, fluid has to go down into the body, into
Right.
the abdomen to be
Sure.
processed. So it doesn't go out your toes. So you got to have something like this. Now, you could lay like this for a short period of time, Brad. I mean, if you were taking a 10-minute nap or something
Right.
like that, you could,
Yeah.
or a little rest period,
Right.
you could lay without the pillows.
Sure,
Right.
right.
So-
Even with the pillows, I don't think I'd recommend that you're going to sleep 8 hours like this.
Sure.
This is more for those when you need to get some rest during the day, half
Yeah.
hour, maybe an hour, where, you're going to take it out. Because if you lay like this all night long, you're probably going to,
Yeah.
may come
Off you
off when
go.
you shift around
Yeah.
a little bit. So,
Sure.
Okay. Now, with the total knee, eventually, within probably a couple weeks, you may want to go to side sleeping, particularly if you've been a side sleeper all your life.
Yeah, and your motion is starting to come along.
Yep.
You're not as not as concerned about getting the knee straight or bent.
Right.
You can start laying on your side, and of course, you want to protect it
Right.
by putting the pillow between the knees.
Sure, and you can lay on either side, as long as it doesn't hurt your knee, it's comfortable. But put the pillow between your knees, and then of course,
Usually, you have double pillows
Yep.
if you're going to be on your side.
yeah, like
Sorry, I
that.
got you a little shock there, Brad.
So yeah, you got a bigger gap here, and we've talked about this with other sleeping videos. On the side, it's 2 pillows, or double it up. On your back, it's a thinner pillow. And you can do this. This is comfortable. You're kind of rehabbing your baby and yourself a little bit. I'm going to double that up, put this pillow under my arm, and just get all snuggled in here.
Well, sometimes we even take another pillow.
Oh, yeah.
And put it like this.
There you go.
And then the arm really stays up there.
Yeah.
So just, contact My Pillow and order a dozen of them, and you'll be set.
Yeah.
All
Okay,
right.
should we go on to the hip?
Yeah, let's go down to the
Okay.
hip, Brad. So
So-
after a hip replacement, these are the things you want to keep in mind.
So some of these things are going to be similar, some not. And one thing that will probably be similar is you may need the leg lifter
Right.
again to get in and out of bed for that first week or two. And then your leg will strengthen up and you won't need that.
Right.
The next thing is, again, on the hip, you're not going to, if you're a stomach sleeper, you're not going to sleep on your stomach after surgery.
Right.
That's for sure. Okay, got that out of the way. So pillows again, while you're on your back. Now, if you had a posterior approach, they came in from the side or the lateral posterior approach, there's going to be 3
Back or
precautions.
side, yeah.
There's going to be 3 precautions. You can't bend your hip past 90 degrees. You cannot internally rotate it. And then you cannot, what was the other? Adduct.
Adduct,
You
yeah.
can't cross your legs. So when you're laying down, you're not going to cross your legs like this.
Right.
Okay. And this one people rarely do, but you can't let your toe point inward.
Right.
Most people never do that anyways. And then, but you can put pillows under your legs.
Yep.
There you go. Yeah, give me a couple, Bob. Oh yeah, that feels good. But the wedge.
I was going to say they can use the wedge.
Yeah, that's not like the knee.
Right.
You can use the wedge.
And it actually puts the hips kind of in a comfortable position,
Yeah.
kind of a loose packed position.
Right.
And it often feels really good to be in this position.
Yep.
By the way, anytime we mention products, we normally have a link towards it to it down below in our description. So it's in our favorite products.
Right. Yep, we got a
Amazon.
number of
So-
them. I did want to mention with this wedge, why it feels so good, I think, particularly with a hip, is the support right here
Gives all the way along the hip.
on your hamstrings
Yeah.
right up, and it does something. It relaxes those muscles inherently. We really like it. So again, you're probably not going to sleep all night with this. This is one of those things that, because it may get wiggled out of the way or whatever, but it's a good thing if you're going to take a nap or just rest throughout the day because you've been out doing your therapy and you need, rest or ice time to put on your hip.
Precisely.
Precisely, Bob.
Okay, how about eventually you can lay on your side
Sure.
too?
With your hip.
You're going to probably lay on the non-operated side, right?
Right, yeah. If this was the hip that was operated on, I got to watch out for my,
Oh, your mic,
my mic. Yeah, if you
Same
got
thing.
a mic in bed, you better take it out of your pocket. Again, you really need to put the pillow between the knees. And with the head, double your pillow up.
Or use 2.
Or use 2, and then you can.
Same thing with the
yeah.
arms.
And my glasses are getting in the way, Bob.
Yeah, they are.
I gotta tell you, if you're gonna wear glasses to bed, take them off. And if you got these click ones like this, they're pretty handy. You can just put them over here. There. Oh.
All right. I don't know. Sometimes, you know, we have people kind of even lean back a little bit more, like
sure.
this,
Yep.
and so it takes a little, puts the pressure more on the meaty part of the butt.
Yep.
And the pillow back there kind of helps support them
Yep.
up. So
It's amazing what you can do with pillows to get yourself comfortable in bed.
Yeah. Yeah.
So,
anything else we need to mention, Brad?
well, let's see here. I think we're pretty much clear with the exception of that one big problem that we're having.
Oh, that's right. Brad and
Yeah.
I can fix just about anything.
Except for,
A broken heart should be somewhere out in this area here. So
and that's, well, the hip and the knee,
put
that's
it
getting
back
a little
together.
closer.
Put it back together.
Yeah.
So
Take care.
thanks for watching.